मेरा दोस्त है, नाम है समी शाह। मैं त्रिपुरा से हूँ। मेरा गांव है गजारिया कैंपर बाजार, वेस्ट त्रिपुरा अगरतला। एक्चुअली ये मेरा दोस्त बहुत दिन से बीमार है। शुगर है, बीपी है, किडनी का प्रॉब्लम है, हार्ट का प्रॉब्लम है। उनका शुगर 15 या 20 साल से है। फिर हमने अगरतला भी डॉक्टर दिखाया। डॉक्टर बोला एक्चुअली एक काम करो, आप बाहर जाके डॉक्टर दिखाओ। तो दिखाने के बाद यहाँ पे पैर में अगरतला से इन्फेक्शन था, तो इन्फेक्शन से पैर ज़्यादा ख़राब हो गया। तो यहाँ पे डॉक्टर दिखाने के बाद डॉक्टर सर श्रीनिवास सर को दिखाया, प्लास्टिक सर्जरी डॉक्टर को। उन्होंने देखा और एडवाइस किया ऑपरेशन के लिए। तो हम लोग आज 5 महीना हो गया ऑपरेशन किया। ऑपरेशन भी सक्सेसफुल है। हम 5 महीने के बाद फिर इधर आया। आने के बाद ये एक्स्ट्रा लेग लगाया और आयुर्वेदिक सेंटर में हम लोग अभी ट्रीटमेंट में हो, फिजियोथेरेपी कर रहा है। अभी बहुत बेहतर है। ये हॉस्पिटल भी बहुत अच्छा है, परिसेवा भी भाला, और जो यहाँ का अटेंडर और सिस्टर वो लोग भी हम लोगों को ज़्यादा ध्यान देता है। अभी तो मेरा पेशेंट बहुत इम्प्रूव है और अच्छे है।
Good morning. I am Mr. Sendil Kumar, Senior Occupational Therapist and Consultant and Head of the Department of Rehabilitation. Today we are going to see the rehabilitation for patients with amputation. So these amputation rehabilitation is classified in 2 different phases. One is with the pre-prosthetic phase, the other one is the prosthetic phase. The pre-prosthetic phase, which is mainly to work on the stump care. Stump care, when I talk, the hygiene of the stump, the strength of the stump, and the range of motion of the stump, and the shape of the stump. The strength, the range, the shape is crucial when we are going to decide on the prosthesis type and how the prosthesis is going to be fit into the stump of the patient. So usually the shape of the stump should be in a conical way. So to maintain that conical shape of the stump, we do figure of 8 bandaging during the initial phases. During this initial phase, when the stump is being taken care, the shape of the stump is taken care, should be taken care very well. So once the shape of the stump is good, so that will help the socket of the prosthesis to exactly fit into the residual limb of the patient. And the muscle strength. The muscle strength is very, very crucial of the stump, because minimum the weight of the stump, the prosthesis will be around 1 kg to 2 kg in between. So the stump should be in a position to carry, to hold the weight of the prosthesis during the prosthetic training phase. And range of motion is very, very crucial again, because we don't want any deformity with the joints if it is in the case of a below knee amputation. So if there is a fixed flexion deformity of the stump, that may not help the purpose of a good prosthetic training during the prosthetic training phase of a amputation. So the strength, the range of motion, and the shape of the stump is very, very crucial in the first stage called pre-prosthetic phase. The second phase of the amputation rehabilitation is prosthetic training. In this prosthetic training, the first step starts with the prosthetic fabrication. So once, if you see the videos, the first step where the orthotic and prosthetic technician take the measurement of the prosthesis. What type of prosthesis and what materials are we going to use with the socket, and what type of foot we are going to select. These things are discussed with the patient and based on the requirement from the patient side. So the first step on the prosthetic phase, prosthetic training phase, if you see, our orthotic prosthetic technician would have taken the measurement of the stump for the good prosthesis. After everything has been discussed with the patient, we have given a endoskeletal prosthesis to this patient. This endoskeletal prosthesis consists of a pylon rod, a socket, and a foot. There are different types of foot available in the market. There are different types of sockets available in the market, and the pylon will be the common one. So like a socket can be a carbon fiber or a glass fiber or a normal resin one, and the shoe can be a polyaxis foot or a single axis foot. It all depends upon how much we are going to spend and what is the need of the patient, what type of physical activity, what type of work is he going to do once the prosthetic training is being over. Based on all these things only you are going to select a prosthesis for the patient. Okay, so after a prosthesis has been fabricated, once the prosthesis has been given to the patient, we have started with the training of the prosthesis with the prosthesis leg. So this training consists of again improving the strength of the amputated leg and the range of motion of the amputated leg. This is a simultaneous process of improving the strength and the range of motion of the amputated leg. As I was already mentioning about the strength, the need of the strength and the range of motion of the amputated leg, because this is going to carry the weight of the prosthesis, which will help the patient to walk independently and do all the self-care activities with the available prosthesis the patient has to wear on. All right. If you see the video of the patient, Mr. Shamir, you will observe this patient will be doing a stair climbing. The patient will be walking down from the stairs. The patient is walking on an uneven surface. These are all the part of the prosthetic training of the patient. Not limited to this ambulation alone. The patient is encouraged to don and doff the prosthesis independently. With the prosthesis on, our therapist involved in training the patient in being independent, whether it is a step climbing, whether it is climbing down the steps, whether it is walking on an even surface and on an uneven surface. So the rehabilitation ends with the proper community reintegration of the patient. So we have simulated the community reintegration in our rehabilitation admission. So the success of rehabilitation here is satisfaction from the patient and patient attenders. So hope we have done a good rehabilitation for this below knee amputation patient. Thank you.